This video is one of the series produced by the Georgia Department of Public Health. Its purpose is to provide training for non-clinical volunteers to enable them to perform basic health care tasks and take pressure off professional medical staff in the event of a wide-scale emergency. Every hospital is different, so check with your supervisor to learn about protocols that are specific to your hospital. While watching this video, please remember these things. As a non-clinical volunteer, you will not be called on to perform any clinical task or to make judgment calls on patients' treatment needs. If you encounter anything unusual or something that you don't understand, you should immediately consult a registered nurse or another healthcare professional. The Georgia Department of Public Health appreciates your help and thanks you for volunteering. An I&O is a record of a patient's intake and output. Intake is what the patient eats and drinks, and output consists of the fluids the patient loses. Accurate patient I&O measurements are an important component in successful patient care. In order to record the patient's intake accurately, you will need to observe the patient's food tray and also ask the patient what items he or she has consumed. For help in determining intake measurement, you may need to use the Food Services measurement chart. It will tell you, for example, that an 8-ounce cup of coffee is equal to 240 milliliters. Output may be measured from a specimen, urinal, or Foley catheter bag. Always remember to wear gloves when measuring output. The first item you'll need is the specipan, which you will find in the clean utility room. Place the specipan under the toilet seat and put the toilet seat back down. Instruct the patient always to void into the specipan so that their output can be recorded. When you are ready to record the patient's output, check the amount by looking at the graduated numbers on the side of the specipan. Empty the contents of the specipan into the toilet and flush it. Rinse the specipan, put it back on the toilet, and put the seat down. Remove your gloves, wash your hands, and record the output amount on the I&O sheet. When a patient needs to use a urinal, instruct the patient always to void into it. Urinals are also found in the clean utility room. When you're ready to record the patient's output, look at the graduated numbers on the side of the urinal to obtain the measurement. Empty the urinal into the toilet, flush, then rinse the urinal. Remove your gloves and wash your hands, then record the patient's output amount on the I&O sheet.